Come, we weigh the rabbit first.
Sure,
Wait,
no
we weigh the rabbit first.
Oh, Sasha, don't jump, okay? She's
wait
a very
first.
jumpy
Yeah.
rabbit.
Yeah, she's a bit
There.
nervous.
See the weight first. Come.
No, she doesn't like when I bring her out in the carrier.
So we put in the weight
She's not
first.
used to it.
3 months old, right?
She's
Male or
only
female?
3 months old. She's a female.
Female. Okay, how many kg?
0.7.
So 700 grams. 700 grams.
Okay, so
come
you
bring up
mentioned
here.
that you don't
Bring
know
her
how
up.
how it happened.
I don't know how it happened. Yeah.
That's
Okay,
not
no,
actually-
table.
Sweetheart, come.
Let the owner touch
Okay,
it.
so you've seen the X-ray, or do we need to explain to you the X-ray?
I have
Wait,
seen
hold.
the X-ray.
You hold first.
You
Hold
can
it.
obviously see that the joint is out of place.
Yeah, my husband, yeah.
Come in.
Yeah, what is the birthday?
25th May.
Oh, okay. Okay, he can come in after it's registered.
Sure.
So you can see obviously that the joint is out of the socket. Okay,
Yeah.
so basically it's a joint and a
Right.
socket.
Yes.
Usually they're together.
Yes.
Okay, now you see that it's out.
Yes.
Okay, so there are several things we consider. This one is a hip dislocation. This one is
Yes.
fairly obvious. Okay.
Okay.
Just
Yes.
Okay, sorry.
No issue. Okay, so basically this one you can see that on the X-ray lah. Okay, it's an obvious hip dislocation. Okay, usually a few things. Okay, usually traumatic in nature means either she jumped and she fell down awkwardly.
Yes.
Okay, either that or there's been some twisting lah. So sometimes careful, don't let it-
wait, hold first.
So sometimes the leg gets caught in, let's say, the cage. Okay, and then sometimes they just pull it and then sort of comes out.
Okay.
Okay, because the rabbit is quite young. Okay, the joint itself is quite weak. Okay, because it's still growing. Okay, so it hasn't really cemented well. Okay,
Okay.
so there are a few things that we need to
Okay,
do.
sweetie.
Okay, so first one will be like what we said, is close reduction. Okay, what that means essentially is under deep sedation, we relax all the muscles. Okay, we try to slot the joint back into position. Okay, this one is not 100% procedure. In what I mean by that is usually within the first 24 hours, there's no debris in the joint, so you can fix it back in. Okay, but because yours is about 3 days, okay, so what happens is the risk, the probability of putting back in is actually worse.
I
Okay,
see.
in a sense, because once the joint, the socket, the ball is out of the socket, okay, debris gathers in the socket. Okay, and what happens is it's harder to push it back in.
Okay.
Okay, that's the first thing. Okay, the second thing is because it's 3 months old, okay, the bones itself are not solid. Okay, they are still growing. Okay, that's why they can grow bigger, you see. Okay, and because of that, the bones itself are actually weaker than when they are adult and long bones. Okay, so meaning that the manipulation itself, okay, we might cause problems with fractures. Okay, we might cause problems with the growth plates. Okay, this is something that you have to understand. Okay, so this one is just it's not necessary that it will happen. Okay, but it's a risk that you have to take if you choose to do the close reduction. Okay, so that's one of the issues that we have to talk about. Okay, the other options for you, okay, is if we can't push it back in, okay, we can do what's called FHE, meaning that we have to take off that ball joint. Okay, and the whole area is
I'm
stabilized.
trying
by
not to
muscle.
go for a surgery
Understand,
option.
understand. Okay, so unfortunately, I'm sure you have already talked to the vet about this, but the close reduction itself, okay, it's not 100%. You have to understand. Okay,
Understand.
means that after even we slot it in, because of the debris, it might pop out.
Okay.
Okay, so that's also one of the things
See,
that
the
you have to
problem
consider.
with that I had was he was not even able to
Slot it back in.
slot it back in.
No worries.
He was unable to do that.
No,
So I feel that if you can slot it back in, then let her recover with the bone in. Maybe when it grows, there is a better chance of it healing.
Sure.
At this point, if I leave it as it is not connected,
Yeah.
then the chances of her leg hanging will be higher as she grows older.
Definitely.
So I'm trying to avoid that.
I
That's why I'm
agree.
rushing today to try and before 7 days. I know after 7 days I can't do anything for her, so that's why we rushed over to do this.
Okay, I understand your concern. Okay, the one of the challenges that we face is after we fix back the joint. Okay, we use what's called Eimer sling, which is actually just to make sure that the leg is don't have any weight, so that the joint can cement back. Okay. But for rabbits themselves, because they are very active, okay, and it's very difficult to control their movement. Okay, so every time she struggles,
Yes.
okay, it might pop out again. Okay,
I
that's the
see.
first thing. And the second thing is for rabbits itself, is because the sling is rather uncomfortable because what happens is we have to push the joint in a position where it's always inside the socket. Okay, so a lot of the rabbits sometimes they go off their foot, okay, because of the pain and discomfort, and it's also very difficult to maintain the bandaging. So we will definitely do the bandaging, it's not an issue, okay, if we manage to put the joint back, okay, but you might have to come back regularly for the bandage changes because for the rabbit herself, it's very difficult to keep that sling in place. For dogs and cats, no worries, because for dogs and cats we manage to.
How long will the sling be in place?
On theoretically it should be at least 2 weeks.
2
Okay?
weeks, okay.
Unfortunately, not much has been done on rabbits itself, mostly on dogs. Okay, so we sort of modifying it to rabbits. Okay.
Okay. So this sling, she will not be able to bite it off, right?
You never know, yeah.
We don't know. But
How do
she
you
technically shouldn't.
Okay. How do you alleviate her pain during this time? Because
Anti-inflammatories.
I think she has received the pain medication, so she's back to normal. She's jumping around.
Sure.
Yeah, and she seems to be back to her normal self.
Sure,
In fact,
sure.
after she got the medication yesterday, she started eating. I mean, her eating and drinking was not a problem.
Fantastic.
So I don't want it to be that I do this for her now and then she stops eating. You know, that is my biggest concern.
Understand. So that's what I'm trying to let you know. Is because now we've given the anti-inflammatory, so all the painkillers are settled. So she doesn't feel any pain, so she goes back on her food.
Yeah.
Okay. My issue is what I'm trying to say is after we do the procedure under sedation, she won't feel any pain at first. Okay, but we will manage on painkillers. But the sling itself is uncomfortable. Okay, so we don't know whether she will still continue on her food or whether her food level will decrease. That one we are unable to tell you.
Okay.
Okay, so that's the situation. I just want you to go know everything first before you go into it. Okay, and don't expect it to be definitely
the solution.
Okay, so that's why we just want to warn you lah.
Understand.
Okay, so if you're okay with it, okay, what we'll try is we'll give a sedation. Okay, it will be a deep sedation, so it's slightly more dangerous. Okay, there's no way to do it light sedation because the muscle has